Hello and salam. Welcome to Muslim Viewpoint, a new podcast series powered by American Muslim Today, a groundbreaking non-profit digital newspaper which champions civic engagement. AMT informs and empowers the diverse voices of almost 30 million Muslims here in the US and other Western countries. I'm Rifat Malik, I'm AMT's editor-in-chief, and today we're looking at how COVID is still impacting our lives, and we have crucial updates on the health scare that's still a factor in public health since the pandemic began in 2020. The US has officially recorded more than 100 million confirmed COVID cases, but the actual number is probably at least twice as high. As we enter a new year, the virus keeps mutating into more transmissible variants, making it even more difficult to control. About 400 people a day are still dying from the virus, and about 5,000 are being admitted to the hospital each day. I'm going to discuss more about this with our producer Maya, who has been researching the topic and looking at the latest media headlines. Tell us what we need to know, Maya.
Thank you. So several states are struggling to keep up with the number of people being admitted to the hospital for COVID, flu, or RSV infections. The Guardian newspaper reported that after holiday gatherings, officials are concerned about the spread of RSV, flu, and COVID, and what they are calling a triple-demic. The CDC reported an increase in COVID cases after the Thanksgiving holiday and another one in the week leading up to Christmas. Hospitals across the nation have felt the strain of this triple-demic. Florida has been dealing with a 3-month peak in COVID hospitalizations, according to the Palm Beach Post. Most of the infections are due to the Omicron subvariant. The Florida outlet says less than 1 in 10 eligible Floridians have received the latest shots designed for the subvariants. The Washington Post also reported a slight surge in cases after Thanksgiving, but it was not as severe as last year's increase in 2021. In Houston, Texas, Omicron variants were found in wastewater, suggesting a mini surge, according to the Houston Chronicle. These nationwide upticks resulted in President Biden announcing his plan to send free at-home COVID tests in the mail. We also spoke to COVID specialist, pulmonologist, and American Muslim Today's Community Health Education Director, Dr. Amir Khan, about the importance of getting vaccinated. Here's what he had to say. If people have gotten vaccinated, why is COVID still spreading?
COVID is still spreading because not everyone got vaccinated. Number one. Number two, a virus is known to mutate. And it's like influenza or flu. Even though everyone gets the flu vaccine, a lot of people get the flu vaccine. Why does flu still occur in the community? And then why do you sometimes get it even though you've had a vaccine of the flu? And the answer to the question to both of them is that the virus mutates. And we've seen that with COVID as well. The COVID virus is mutating as well. And I think in a nutshell, that's the answer. That it's going to keep on mutating. It's again coming down to the fact that if you're vulnerable, you're going to need to get vaccinated regularly.
And who is vulnerable?
In the lung clinic, I'm seeing people who have lung problems is one. If you have been a smoker and COPD, if you've got a history of asthma and your family history has allergens, if you have scarring in the lung and bronchiectasis, people with a condition called cystic fibrosis, which is scarring again. And then people who are generally immunocompromised, HIV patients and those who are immunosuppressive medication. Sometimes, so all of these people are vulnerable. They would need extra precautions and they would need extra medications.
And why are vaccines important for vulnerable populations and everyone as well when it comes to stopping the spread of the virus?
There is reported 30 million people in China right now who are undergoing or having COVID spread. And the answer to the question is, if you don't get mass population vaccinated, you're going to end up seeing a surge, and you're going to see the virus get to you one way or the other. The question is, if the virus gets to you, are you in a condition of fighting the virus? Because everyone's going to get exposed. And what we have seen, that your chances of fighting the virus is many times better. I don't want to say 100 times better, but many times better, unable to quantify, if you are vaccinated versus you're not vaccinated. I'll give you another example which you could put in. Even in my practice right now, I have 4 people who are off with COVID. But they're all very comfortable and home and isolated only because they've been vaccinated.
Right. So if they hadn't been vaccinated, what do you think would have happened?
We're still seeing patients in the hospital, my dear. These are the patients that they're in a much worse shape. They're needing much more oxygen, and their lungs are much more damaged than people who are not vaccinated. They're just too bad. They're not able to fight any infection.
Why are booster doses essential for combating the subvariants like the Omicron and things like that?
Because so far we've seen our population versus other populations, whatever infections we've got, our infections, COVID infections particularly, the corona, has more or less the variants and strains so far all have been covered. And I think going forward, as they see more mutations of the virus, they're going to modify the vaccine a little bit. So the newer vaccines are a little bit more or better equipped as well to combat even the variants. So we have all of the variants covered right now. And I think that's a big advantage of why. Maya, that's a big advantage living in the US. A lot of other countries have not developed. Even China is struggling.
Right, and so why do you think that is? How can our country develop the vaccines necessary faster than other countries?
I think the question really is, we should keep investing in research, researching newer techniques to develop the vaccine, as well as keep an eye on the enemy. The virus mutates, so we should be watchful about the mutations that are occurring and make sure that we are ahead of the game and don't do what we did last time, let it spread and then get on top, but to keep monitoring, to keep ourselves safe, and to keep developing techniques to kill the virus and its strains.
And then, so obviously we're going to keep having vaccines that we have to get. And there have been reports about, people having vaccine fatigue and it affecting other types of vaccines that don't have to do with COVID. So what should people do to feel comfortable and safe and, why should people feel comfortable getting vaccinated? Even if it's not for COVID?
You have to keep an eye on the bioprofile of the vaccines. There are millions of people who have been vaccinated so far. And it's no brainer now, a year plus on, the side effects of reported vaccinations very, very low. These are astonishing results so far. The people should read the literature and look at on the risk of this is the benefits tremendously have been outweighing the risks that are associated, which are very little with the vaccine. So if they read the literature and see how a turnaround we've made in the US in terms of getting COVID under control, they should definitely feel comfortable with using versus not using.
I guess last question, I don't know if you want to answer. Why is it important to understand the long-term effects of how COVID affects our bodies and our lungs?
I think just in general, Maya, we need to make sure that we don't stop doing research in COVID right now. I think that is very important. I think once we're doing research, we're staying ahead of the game. We're far better situation than countries like China, India, and other countries in the West, including Europe. So it's what you invest you will get the results at the back end. And since this is a moving target right now, there's just so many things going on with the COVID. I think we just should keep on investing in it and make sure we don't just stop rolling the dice and we don't stop looking after our people.
So, Maya, tell us about how many people are vaccinated.
According to NPR, only 15% of people eligible for the COVID booster have received the shot, which is at a rate lower than the flu vaccine. These are not the only vaccines people have abandoned. It was also reported that rates for measles and polio shots have declined as well. Experts attribute this decline to what they call vaccine fatigue, meaning people are tired of being told to get vaccinated, therefore neglecting personal and public health. After 2 years, almost all COVID restrictions have been lifted, therefore leading people to believe we have gone back to normal. However, the virus continues to spread because not everyone is vaccinated or taking proper precautions when they are ill, as Dr. Khan will explain. So only 35% of people over the age of 65 have gotten updated boosters, and 3/4 of the COVID deaths in the U.S. are among people in this age group. How can you persuade this demographic to get vaccinated?
I think the key is social media and the key is education. I think there's no other way around it. I think people had a lot of apprehensions about the vaccine and it should not exist anymore. So the more we campaign, the better forcefully we put our point, you're going to see results.
Under vaccination is believed to be misinformation. This isn't helped by recent moves by social networks like Twitter, which stopped enforcing its COVID misinformation policy. Are you hearing patients' unwarranted fears around vaccination, and how do we counter this? Basically, how do we counter misinformation?
I think we should target the patient population. I think the older patient population, middle-aged older people, are very vulnerable. The vulnerable groups need to be targeted first. The vulnerable lungs and those people who are at high risk should be targeted first because they have a high mortality. So those should be targeted first versus trying to vaccinate kids and stuff, which we don't really need to do. And if we look at patient populations that are 50-year-old we have today, the ones above 40 above, and especially those with lung issues, they should be targeted. So we should reach out to healthcare institutions, hospitals, practices, and we should continue giving that strong message to put it out in every form of media to make them aware that the information of positive, robust data on vaccine now that is available comes across their eyes. So and there will be little steps to persuade their minds that these vaccines are lifesavers and can help in the long run.
So let's talk about long COVID, which is a lingering form of the virus that's afflicting people years down the line.
As COVID is a new virus, the long-term effects are largely unknown. Although after almost 3 years of a pandemic, scientists are now trying to understand the possible lasting symptoms of COVID-19. Fatigue, lung problems, and brain fog are all symptoms of the lasting effects of the COVID-19 virus, as reported by PBS. Research suggests that women are more likely to develop long COVID due to being more at risk for developing autoimmune diseases. The same report noted obesity as a risk factor for severe or long-term COVID symptoms, as the virus can reproduce in fat tissue. It is estimated that 30% of those who have had COVID will experience lingering symptoms for about 3 months after being sick.
Well, thanks so much for that roundup, Maya. And it's clear that medical professionals are united in still advocating for the entire population to get vaccinated as the virus continues to mutate. It's also clear that people need to listen to the science behind the medicine and should feel safe knowing that people who are vaccinated make a full recovery from the virus after getting sick. As immunity from the virus wanes after getting vaccinated, it's important to also stay updated on your booster shots. Thank you for joining us this week from Maya and myself. Be sure to follow us on Instagram, Twitter, and TikTok at American Muslim Today. And if you'd like to read more about this story and access more digital content, feel free to check out our website, AmericanMuslimToday.com. We'll see you next week on The Muslim Viewpoint.